Hello, I'm Wes Perkins. I'm a professor of sociology at Hobart and William Smith Colleges in Geneva, New York. I'm here today talking about the social norms approach, helping people understand this new strategy for promoting health and reducing problem behaviors in youth populations, adolescent populations. This is a conference of prevention workers, health educators, teachers, people working in community coalitions trying to address problems ranging from adolescent bullying to alcohol substance abuse to issues of sexual risk-taking. And I'm here to talk about an innovative strategy that we've been doing a lot of research with and implementing with success. So we can teach people about the pharmacological effects of alcohol and other drugs, about the risks and dangers involved with certain health-related behaviors, and simply giving them that information doesn't make them or lead them to reduce their risky behaviors. We give them the information and we assume that they're going to make the right choices. People don't act that rationally. We most often look to others to find out what other people are doing. We're all herd animals. We're peer-oriented, and we're most often relying on what we think other people are doing. Traditional health education hasn't been very effective. What we then often turn to, I'm saying the field of health promotion and preventing risk behaviors, we often turn to what I call health terrorism. That is simply trying to scare the health into people. But we know today from lots of research that scare tactics don't work either. People pay attention to it, are interested in it a bit voyeuristically, but they think it's probably not going to happen to them. And they're often quite right that it won't happen to them, and so it doesn't work very well as a way to discourage people from engaging in risk behavior. So what we find is that scare tactics don't work, and when they don't work, often people will roll up their sleeves and say, let's just make it scarier. That's why it didn't work. But when we try to make it scarier, what we're really doing is giving a message about something bad that might happen, but is probably not going to happen at all. And the scarier it is, the less likely it is to happen. So the social norms approach starts from the point of view that humans are group-oriented, that we largely operate within packs, that norms are critically important in guiding and shaping our behavior. And when I say norms, I mean those behaviors that are most common in the group and those attitudes that are most common in the group. That's what we mean by norms. Researchers in psychology and sociology have demonstrated time and time again that social norms are one of the most influential factors shaping the behavior, especially of youth and with regard to health-related behaviors and risk-related behaviors. So the work that I've been doing on social norms is really focusing on the question of perceptions of norms. Is the perception of peer norms the same as the actual peer norms? And what we find after doing loads and loads of research is that they're in fact quite different. Most people, youth in particular, but people in general, misperceive the norms among their peers. The norm is positive, protective behaviors. Even if there is a significant or large percentage engaged in risky behavior, it's not the majority, and yet we most often perceive it to be. We typically overestimate the risk behavior that it goes on among our peers, and we underestimate the protective behaviors and the protective attitudes that our peers have. And we've done research in schools across the United States, in Canada, and there's research going on in the UK now as well, demonstrating this point that whatever the actual norms are, the perception of the norm is far in excess in the direction of risky behavior. So there are these huge misperceptions. For example, most university students think that the majority of their peers are cocaine users when only 5% are using cocaine. The majority think that almost everybody drinks at high-risk levels, sometimes called binge drinking, when in fact it's not the majority of students. Young kids think that almost everybody in their school engages in bullying behavior when it's about 30% or 20% of the school. These are big problems, but it's not the majority. It's what I like to call a reign of error, that in fact that we're guided by and influenced by what we believe to be the norms much more than what are the actual norms. So if I think that everybody else is going to be doing it, if I think everybody else expects me to be doing it, even if I'm wrong in my perception, I'm likely to be pushed along to engage in the behavior, even if I'm ambivalent about it, because I think that's what everybody else is doing and I think they expect it of me. And the person who does engage frequently in high risk or problem behaviors and likes to do so can do so freely, thinking they're just like everybody else. So the bully, the cocaine user, the high risk drinker, those who are taking frequent sexual risks in their personal behavior and activity can do so thinking they're just like everybody else. And most other people who don't engage in these behaviors perversely encourage the high-risk person to do so by thinking and communicating that they, the high-risk person, are just like everybody else. So what does this mean about prevention work? Well, what we really have to do is get the truth out. The social norms approach says, let's find out what the real norms are. Let's collect data, collect information, and in anonymous surveys that will convey what the real truth is. When we interact with young people, giving them the information about what the true norms are, we begin to erode their misperceptions. No one is going to, after solidly believing that the majority are participating in the problem behavior, immediately change their mind. We've got to start the conversation, and we've got to give them lots of information based on credible data, and we have to give lots of dosage of that information. And finally, what we have to do is stop doing as much of the scare tactics as we have traditionally done, and we need to address these misperceptions on a constant basis, because the forces producing these misperceptions are out there operating all the time. When we talk about a behavior we observe, it's usually not the behavior that most people are doing. It's the behavior that's the extreme. Somebody who looks the most different, who exhibits the most extreme behavior. That's what we talk about. It might be funny, it might be sad, it might be disgusting, and it might be frightening, but that's what we talk about. But the more we talk about the extreme behavior, which is often the risky or problem behavior with regard to health among adolescents, the more we talk about that, the more we tend to think and can help others think that it's normative. What we need to do as a strategy of intervention is the exact opposite. Talk about the fact that the majority are not the problem, that the majority are exhibiting healthy, positive behavior, and talk about that in a variety of venues. When we do that, it makes a difference. And we now have many case studies, many research examples and sites where schools and communities have started promoting what the majority do and think in terms of positive behavior and seeing significant reductions. Studies showing that we can actually reduce violence using this strategy. We can improve people's recycling behavior by letting them know that more and more people are recycling. There's a variety of areas of our lives that simply knowing what the majority do and knowing that the majority are doing good things actually draws more people into doing those things.